strike as Ambulance Crews Plan Walkout. Hi everyone, welcome to AR News. About 10,000 NHS nurses in England, Wales and Northern Ireland are to strike for the second time in less than a week in protest over their pay. Wednesday will see ambulance staff in England and Wales walk out too, unless a meeting later with the Health Secretary can avert it. Steve Barclay has invited 3 unions representing pandemics to talks. It follows warnings to extensive distribution to service at a very challenging time of year for the NHS. The joint letter was set out by the Health Chief of NHS Trust and Integrated Care Board in England, urging hospitals to free up beds by safely discharging patients ahead of industrial action by Ambulance Crews. Measures should also be put in place to make sure ambulance patients' handover are kept to no more than 15 minutes, it advises. Nurses staged the biggest ever strike in the history of NHS last week. Nearly 10,000 staff were absent on Thursday and 16,000 appointments and surgeries had been rescheduled in England alone. Tuesday 12 hours walkout, which starts at 8 GMT, would cause similar distribution, although service such as urgent cancer care will continue. The strike involves nurses in about a quarter of hospitals and community terms in England, all health boards in Northern Ireland and all but one health board in Wales. Nurses are not striking in Scotland. Protested services included chemotherapy, emergency cancer service, dialysis, critical care units, neonatal and pediatric intensive care, along with some areas of mental health and learning disabilities and autism service. The walkout is mostly about pay. In England and the Wales, most NHS staffs have already received a pay rise roughly of €1,400 this year, more than 4% on average for nurses. The Royal College of Nursing RCN union wants 19% pay rise, 5% above RPI inflation rate, which currently stands 14%, saying its members have received years of below inflation pay increase. Prime Minister Rishi Sunak has said the pay offer to nurses is appropriate and fair, despite pressure from the health leaders and some former Conservative ministers to rethink. But RCN General Secretary Pat Cullen said he should ask himself why nurses were taking unprecedented strike actions, sacrificing a day's pay, and highlighted worries over patient safety and the future of the NHS. Calling for talks with Mr. Sunak, with Cullen said, "Let's get this wrapped up by Christmas. I will negotiate him at any point to stop nursing staff and patients going into the new year facing such uncertainty. But if this government isn't prepared to do the right thing, we'll have no choice but to continue in January, and that will be deeply regrettable," she warned. The government maintains the nurses' demands and are unaffordable, and the recommendation of an independent pay review body in setting wages have been followed. Health Secretary Steve Barclay said it was disappointing union members were striking despite the impact on patients. The RCN's demands are unaffordable during these challenging times and would take money away from frontline service while they are still recovering from the impact of the pandemic, he said. He added that he was open to engaging with the unions on how to make the NHS a better place to work. The RCN has threatened to escalate strikes action if ministers do not join talks within 48 hours of Tuesday walkout. The action by nurse will be followed on Wednesday by a strike by ambulance staff. When Unison, GMB and Unite members take action, GMB union members will go on strike again on 28 December. Around 1,200 members of the military are being drafted in to cover the striking ambulance workers in move unions call a desperate measures. It is expected they will be handling less serious calls. All of the most life-threatening calls like cardiac arrest will be responded to. But people who suffer trips, falls and other non-life-threatening injuries may not be sent an ambulance. Northeast Ambulance Service said it would not be able to respond to all calls of serious nature, and some patients would have to make their own way to hospital. Stephen from the service said ambulance will still be able to respond during the strike, but this will only be where there is an immediate risk to life. This means that less serious calls will not be received a response, and some patients might be asked to make their own way to hospital, where it is safe for them to do so. London Ambulance Service also warned that patients with conditions that were not life-threatening were unlikely to get an ambulance on strike days. The strikes in the health service are part of widespread industrial action across the number of public sectors. The main union representing border force staff is set to walk out for 8 days between 23 to 31 December. Postal strikes will take place on 23rd and 24th December, some of the busiest days of pre-Christmas deliveries. The RTM Rail Workers Union is also set to stage strike action between Christmas Eve and 27th December. People who are seriously ill or injured and those life is at risk should call 999 as usual or call 111 for non-urgent care. Other services such as some cancer treatments, mental health service, and urgent testing may be partially starved. Routine care is likely to be badly affected, including planned operations such as knee and hip replacement, community nursing service, and health visits. Official advice is that those with an appointment which hasn't already been rearranged should turn up at their allotted time. GP, community pharmacies, and dentists will not be affected. Thank you.